Hi, good morning, everyone. This is ST120 sterile processing, our Unit 1 discussion for the week. So I'm looking forward to a good semester or quarter with you guys. It's only 8 weeks, but we have a lot to cover. My name is Megan Ludwig. A little bit about me here. Um, I've been teaching a lot of different classes, really. I'm a surgical technologist. Been teaching for approximately 10 years now. I've been teaching here at Herzing for let's maybe the last 6 months. So I'm relatively new to Herzing. I still teach at a local community college in my area, teach a variety of surg tech classes, anatomy, med term, lab, all kinds of stuff. So I've been in the field for a while. I've been a surg tech for well, since 2008. So you can do the math. I've been around a little bit. Okay. So here's me working in the lab with my students. I really enjoy that aspect of my job. Then here's a picture of me and my two kids, my little goobers. This is Zach and Zoe. They're a little bit older now than what they were in the picture, but I just like that picture. So here is your book and your workbook that you probably have, I would assume by now. If you don't, send me an email or, we can work something out that you will need throughout the course. It also tells you, every week what you need to cover. All right, so on the agenda today, went over the introduction. We're going to go over some objectives. So I'd like to go over the objectives every week so you kind of know what we're getting into in our learning content. We'll talk a little bit about, what you'll be seeing as far as your assignments go throughout the week. Summary and questions. So let's get started. Here are your objectives. Throughout, really, you're going to see some of these kind of repeat because you really do these all the time. Okay, like for example, you're going to learn how to demonstrate the principles of aseptic technique and sterile technique, which we'll talk about here in a bit. Identifying equipment and sterile supplies using the operating room and other areas of the healthcare facilities. We're going to apply principles and techniques for proper decontamination of instruments. Talk like more details about those in coming chapters. Prepare surgical equipment and supplies for sterilization, storage, and distribution according to industry standards. You're going to identify proper processes of mechanisms for sterilization used in the OR. And then we're going to talk a little bit about PPE, what you have to wear. Okay, so every week I'm going to show you what your assignments look like. So I just grabbed this from the syllabus. It's easy to just look through the syllabus part and see week to week what you need. You could also go through the module section if you'd rather do that, or you could go through the calendar. There's a couple ways to do that, but make sure you are accomplishing each of these. So typically, if you go through the modules, it will basically tell you to go to the next one, okay? But just double check. There is a pretest down here at the bottom. It is worth 75 points, so you do have to do that. Do the best that you can. We want to see where you're at, and then it kind of gives you an idea of where you're going to go, okay? With these unit discussions, you will have a discussion post every single week, okay? The first post that you will make is due on Wednesday. That there's a section, once you click on this discussion, it tells you the things that you need to cover, like the question prompts that you need to answer in your response, okay? You also need to cite your sources. You need to have sources for every single discussion post that you do. You have to back up your opinion, so to speak, okay? Especially because this is new and you don't necessarily know everything yet, okay? So it's not common knowledge for you. You have to have sources. And then you also have another post that you have to make, actually two other posts that are going to be in response to your peers. You have to have two responses to peers, two different posts for full credit, okay? So all of that totals up 40 points. And you'll see the rubric for how those points are broken down. But I will tell you the things that I have noticed that students get points taken off for the most will be not responding to their peers and not citing their sources in APA format, okay? If you go to the Learn Your Library Sources, there's a link to that in your syllabus. There's a whole section on how to use APA format and cite sources. It's not that hard once you get the hang of it. So make sure you're doing that so you don't get points taken off every week. If I do take off points for any assignment, whether it's discussion or a big project later, whatever, excuse me, I will always put why I took points off. Okay, so make sure that you go back. If you see you didn't get 100%, go back and see why. That way you're not making the same mistake every single week and getting the same points taken off every week. And you come to me, right at the end of week 8 and you're like, what can I do to make my grade better? I'm failing. Make sure that you are checking those every week. If you notice in a couple weeks that you're struggling, please reach out to me before we get to week 7 and 8. Okay, you really need to stay on top of this because it does move pretty quickly. I mean, it's an 8-week course. Things have to move quickly, right? So I'm assuming this is not your first course here at Herzing, so you probably understand that. Okay, so please feel free to reach out to me with anything. I'm open, send me an email. If my office hours don't work for you, we can set something up. Okay. Also, these realize it checks, there's no making those up, so you have to get those done. Okay. If for some reason some crazy emergency happens, you need to email Mrs. Kish and CC me on it. She's the only one that can override that and let you do that. Okay. All right. So let's talk about sterile processing now. Enough of the assignments part. So sterile processing, there's a lot of terms for sterile processing. It could be sterile processing department. It could be central services department, the sterile core, sometimes different hospitals have different names for stuff like that. But generally we're going to call it the CS or the CSD, Central Services Department. And it's called central because typically this department in the healthcare facility, whether it's the hospital or smaller ambulatory center, is located probably centrally. So the reason for that is this department, sterile processing, doesn't just work in the OR or for the OR. It actually will sterilize equipment for all parts of the hospital or facility. Things may have to go back to the 3rd floor, may have to go back to the ER, things that the ER trauma team needs to work on a patient in the ER. Okay, so it is central. They work for the entire hospital. They are really the heart of the hospital, if we're being honest. Okay, without them, really nothing else could get done, honestly. They are responsible for making sure their equipment stays effective. They have to learn how to process things correctly. They work on the whole, we'll go through the steps of decontamination all the way through sterilization. The Central Services Department also has to maintain their education. So once you finish this program and you graduate, you go to take that certification test, you need to keep that up, okay? Maintaining your education by doing continuing education units is super important because any healthcare job is going to change rapidly just because we learn things by doing different studies, research, etc. We want to make sure we stay with the industry standards. Super important. Okay, so like I said, it could be called a couple things: central processing, sterile processing. You'll learn whatever facility you go to what they call it. So what exactly does a sterile processing tech do? Some of you may already know by now. This is what you want to do. I'm hoping if this is the path that you've chosen, you've probably researched it a little bit, right? But there's some other skills that are also super important aside from sterilizing the instruments or decontaminating things, okay? There's a lot of things that go into that. First of all, you have to be a good team player. You have to interact with the team because it's not just you in the department, right? You're always going to have coworkers, but not just the coworkers down in sterile processing. You're going to be in contact with people inside the OR. They're going to call you and be like, I need that thing that does the thing. Sometimes they don't know what they're asking for, but a good sterile processing tech will. They know exactly what that surgeon needs. Sometimes the surgeon will call and say, I need something such and such for this case. Can you bring it up? Can you put it on the case card? So you will be in contact with other people, OR people, nursing on the floor, upper management. So having good communication skills is vital because that's like the first step of all things. If you can't communicate with someone, then the process breaks down. I think we probably learned that in life, right? Having good communication skills. Also, you have to have good ethics. These are, communication skills and ethics are sometimes what we call soft skills. They're a little bit harder for us to teach. I could teach you all day anatomy, instruments, sterile processing, all that stuff. But it's hard for a teacher to instill ethics into somebody. That's in your head. That's your actions that you portray when nobody else is looking, right? So having good moral ethics, a good moral compass is very important in sterile processing because you also have that patient's life in your hands in a way. You may not have direct hands-on, but you are going to be responsible for making sure those instruments were sterilized properly. If you skipped a step and knew it and just pushed it through anyway, you're putting somebody's life at risk. So you have to have strong moral compass. You have to respect the patient's rights too. They have a right to good health care. That's why they came to your facility. Some other basic responsibilities, like I said, you're going to understand sterile processing techniques, why we have to study microbiology, how those germs work, so we know how to kill them. We will talk about IFUs, so instructions for use. Every piece of machinery, everything you get in sterile processing will have an instruction for use. So that comes from the manufacturer. You always want to contact or, look back at that if you're not sure to make sure you're doing it correctly. So we'll talk about those later. And then sterile processing practices and procedures, what are the industry standards? You have to stay up to date with those, going through those steps to make sure everything is done perfectly. All right, so a little bit about the sterile processing area. We're going to consider it in having 3 areas. Okay, so there's going to be a soiled area in the decontamination part. There's a clean processing area after it's been cleaned in the soiled area. And then finally, once it's gone through the clean processing, your instruments or supplies will go to the sterile storage area. So notice the area, it is a one-way workflow, okay? You can't take sterile items, carry them back into the soiled area. Theoretically, at that point, they're contaminated and you have to start over. We always say you have to keep clean and dirty separate in the whole process, okay? You can't cross over, you can't go back and forth. If you have on your PPE that is set up for, being in that decontamination sink and you've been cleaning instruments, you can't just go walk out into the sterile storage area. You have to take that stuff off and make sure you're appropriate for the next area, okay? Clean and dirty separate, super important, okay? So decontamination, this term here, just means removing contamination to make items safe for handling. So that's what you're doing in the soiled area. They come back to you from being used on the floor in the OR. You're decontaminating them and putting them through a deep washer decontaminator to make it safe for handling. That way you can restring them, reprocess them, and then send them into a sterilizer to be used again. So what does sterilization mean? We throw this term around a lot, right? You must know the definition of sterilization. Obviously, it's important, right? So it is the process of removing all living microorganisms, including spores. That's your key, including spores, okay? Because spores are things that certain bacteria, not all, certain bacteria make in order for them to basically keep themselves alive. So it makes them very resistant to certain sterilization methods, heat, whatever it is, by the fact that it creates almost like a little dome. It creates a little hard shell for it to live so it doesn't get killed. But we have to make sure they get killed. Otherwise, they can come back to life and then, cause an infection. We don't want that. So certain parameters must be met for sterilization. There's going to be a lot of parameters. I can't even cover all of them right here, but a lot of them have to do with time, temperature, pressure, or like steam saturation, certain parameters for even certain instruments, different wrapped sets, all have to be met, okay? Otherwise, it's not sterile. So again, always refer back to your instructions for use, like for this big sterilizer over here. How do you use it? If you don't know, you better be looking, okay? So there's also a storage and distribution area. So aside from the decontamination area, most is going to be very close to the same area just for continuity purposes. It's easy. So most of the things, once they are sterilized, will stay probably within that CS department. If another part of the hospital does need an item, which they're going to, a lot of times they're taken by some sort of system. A lot of times it's like a case cart, especially if we're going to the OR. It'll look something like this. It may not be exact, but it's pretty similar. If we're talking about going to the OR, the central services also has a pick sheet, or sometimes called a preference card, a surgeon preference card. That's just going to have a list of everything that the surgeon needs or possibly could need for a specific case. So these cards are specific to the surgeon and the procedure in which the surgeon is doing. That way, it's pre-populated. It's usually kept on a computer anymore. Everything's pretty digital. So they'll get printed out, and then whoever in sterile processing will take that and like go through each item, put it on the case card and pull it for that case. A lot of times if it's, a scheduled case, they'll do it the day before and they know it's coming. If it's like a stat case, maybe the surge tech will have to run down and help. Maybe there's nobody in sterile processing. So, it could happen a lot of ways. So we talk about the processing cycle when we are talking about, keeping the clean and dirty separate. The processing cycle of the instrument, we're going to say it starts with clean, it's been inspected after it's been decontaminated here, inspected to make sure it's okay to reprocess and use. It's going to be reassembled and properly packaged according to what it is or how it needs to be packaged. Then it's going to be sent right back through the sterilizer, and then go back to that clean storage area somewhere in CS. And then it will be dispensed once it's needed. So that's the cycle. You may have a pair of forceps that get used a million times. It goes through the same cycle every time it needs to be used for the next patient. Okay. I talked a little bit about ethics before, but just remember that ethics is doing the right thing even when no one is looking. Okay, sometimes it's hard to do when we're like, oh man, I messed up, but I don't have time to fix it. It doesn't matter. You'll make time, you'll find time. You may think nobody's looking, but I can tell you a lot of people see things more than you realize. And they may, especially as a new person, a new employee or a student, they may be looking to see what you do in those instances when you think no one is looking. I do that with my students. I want to see, what their moral compass is. I want to see what we call it a surgical conscience in surgery. How do they act in those cases? Because it tells you a lot about a person, whether or not they do the right thing. If you are one that likes to cut corners, then maybe you either need to change your lifestyle or reconsider the job, because this is not a job where you can cut corners. It just isn't. Also respect. You're going to have respect for your teammates, for the patient, for the surgeons, everybody that you're working with. Goes back to ethics. We also throw this term out here, standard precautions. So when we're processing instruments, you have to take into consideration something called standard precautions. So that means you're basically going to treat everything that was used on a patient like it has an infectious disease on it, okay? Never just think, it's fine. I don't need to use gloves with that. Always use standard precautions. So there are certain things you would do. You would use gloves, proper PPE. You treat everything like it's contaminated. That way it protects you, protects the patient, okay? So we'll talk more about, the different ways to use PPE and more infectious diseases later. So I want to show you this quick little video. If you've never been in a sterile processing department, this should be interesting to you. If you have, watch it anyway. I'm just kidding. So it's a nice quick little video about, behind the scenes of the sterile processing department, what the different areas are, what happens on a daily basis. So I really like this video.
One of the most important areas of Mary Greeley Medical Center is right here. We're in the sterile processing department, and it's where all the surgical instrumentation gets cleaned and sterilized for any upcoming surgeries. And not many people get to see this area, but I'm going to give you an inside look into the sterilization process. Each day, we see hundreds of different types of instruments that require hundreds of different ways to clean them, and each sterile processing tech must learn these to ensure that the instruments used are safe for the next patient. Instrument reprocessing begins in the decontamination room. This process begins by soaking and manually cleaning each instrument in a sink filled with a water and detergent mixture. This helps break down and remove the blood and other materials that can be left from surgery. We call this material bioburden. We use a variety of different types of brushes, syringes, and automated irrigators to remove the remaining bioburden from the instruments. After all the bioburden has been removed from the instruments, we rinse them and move them to the next step in the process, ultrasonic cleaning. With ultrasonic cleaning, we are removing the remaining biofilm that cannot be seen. Ultrasonic cleaning works by creating ultrasonic waves that travel through the water. These waves create tiny unstable bubbles, and when these bubbles come in contact with the instrument, they implode and remove the remaining biofilm. After all the biofilm has been removed, the instruments are rinsed and prepared for the final step of the decontamination process, mechanical cleaning. Mechanical cleaning is done in a washer disinfector similar to a high-powered dishwasher. This step removes anything that might be left on the instruments. The washer rack has spray arms that spin and clean the instruments using detergents and high-pressured spraying water. Each cycle provides a thermal disinfection so the instruments are safe to handle. When the cycle is complete, we can now inspect and assemble the instruments in preparation for sterilization. Assembly begins by inspecting each instrument to ensure that they are working appropriately. We then arrange these instruments into sets that will be used during specific types of surgical procedures. Each set has many types of instruments in common, as well as instruments that are unique to a specific surgical procedure. So each sterile processing tech is responsible for learning each instrument and how it works. This provides the surgical staff everything needed to provide excellent care for our patients. We then prepare the instrument set for sterilization by placing all the instruments in a mesh basket. The basket is then placed in a specialized container that is designed for sterilization. Some containers have a sealed hard outer casing, and some must be wrapped with a specialized material called blue wrap. Both types of containers are designed to allow the instruments to be sterilized in the container, and once sterilized, maintain the safety of the instruments while in storage. Sterilization is done by using different methods such as steam, vaporized hydrogen peroxide, and a variety of other methods, but the most common instruments that are used in a surgery are sterilized using steam. To make sure the sterilization process has been effective, we use chemical and biological indicators. Chemical indicators are placed on the outside of blue wrap or a rigid container and allow us to know at a glance that the instruments have gone through the sterilization process. They are also placed inside the container with the instruments so the surgical staff knows the instruments were sterilized and safe for use on our patients. The biological indicators help us verify that our sterilization process is effective enough to kill all the germs that may be on our instruments. This process helps us know we can provide patients with the best possible care. Once the instrument set has been sterilized, they go into our sterile storage area until they are needed for the next surgical procedure. This area is also the staging area for the next day's surgical procedures as well as potential emergency surgeries. And once the instruments are ready, we assemble them on a case cart to be sent out for surgery. Be sure to check out mgmc.org for more information.
Great, there you go. So I really like that video. It's short and sweet, shows you exactly the process, that one way, actually the one-way process. It showed you in order. I really liked that. So hopefully that was helpful to you. Gives you a little idea of what to expect in the next 8 weeks. And once you go out to the field. Mouse here. All right, so in conclusion, sterile processing is the integral part of the hospital. I've always told my students that it's basically the heart of the hospital because without it, honestly, nothing else would work. Nothing would flow. Cases wouldn't get done. There would just be this huge void in patient care that we couldn't do. You're also going to be responsible for decontaminating instruments, prepping them, like he said, making it clean for handling, and then repackaging them so they can be used again. You always have to sterilize things according to IFUs. Like you said, there are over, there's hundreds of different, configurations as far as how things can be sterilized based on what the item is. So that can be a lot to remember. So make sure you check your IFUs. You will also learn how to apply knowledge of surgical procedures. So that does come a little bit with time and just studying those surgical procedures. It also comes with, practice knowing this case cart, this pick sheet for the surgeon, this is what they need. Sometimes it takes some time. And you're also going to work as a team. I can't stress that enough because, one bad apple can ruin it for everybody. It really can affect how somebody's day goes. And when we're talking about patient care and we're affecting how people's day goes, it really could have a bad outcome. I've seen it happen. If instead of being, short and grumpy or whatever, instead of just, saying, yes, this is, communicating properly, this is what we need, this is how we fix a problem, that's usually where the issue comes, is conflict. And working together as a team, because you need to remember the reason why you're there. I mean, a lot of people go to get a paycheck, I understand that, but you're going there for the patient. You have to remember that, okay? Everything you do is for a patient. So keep that in mind. Okay, summary again, watch your dates when we talk about assignments. You could find all the dates here in the calendar. They should be in there correctly. Or again, you could go to the syllabus, whatever. But maybe print those out or write them out on your date book, calendar, whatever it is you have to make sure you're staying up with those. Okay, because there are a lot of things every week and it can be easy to get behind. I don't want to get behind and have points taken off down the road for late work. Okay, you can submit late work for a penalty. I think it's after 2 weeks, it's like a 50% deduction, but you really want to stay on top of those because if you notice, and I didn't mention this before when we talked about assignments, but assignments are weighted differently. So, if you miss like one writing assignment and there's only one and you get a 0 on that, you'll fail. That's just how it is, okay? You have to make sure that you see how those grades are weighted. If you happen to miss one discussion post, you'll probably be okay. I'm not encouraging you to do that, but watch what you do and what you miss. Some things can't be made up like to realize it. If you just forgot to do it, that's a 0. There's no making that one up. Okay, so be very careful. So if you have any questions, please feel free to reach out to me. You can email me here at mludwig@herzing.edu. I do have office hours today from 12 to 2. These discussions will be at 11. And they are recorded and I'll post them every week to your announcements so you can watch them whenever. That's fine. But if you come up with a question later throughout the week, just shoot me an email and we can figure something out, okay? So I hope you guys have a great week and welcome to Unit 1. Bye.